brought this conversation, and we're very lucky that we've been joined by a wonderful guest over here who happens to be a gynecologist and obstetrician at Maroof Intl Hospital, Islamabad. She happens to be Dr. Aisha Farukh. Hello, madam. Assalamu alaikum. Good morning. How are you?
Good morning. How are you?
Absolutely
Thanks for
perfect.
having me here.
Thank you so much for joining us. Wonderful to have you over here as well. So this word, family planning, we've been hearing about it. What is it? Tell us about it.
Family planning, I'm really thrilled to talk about this topic because it's not only my passion or profession. I'm really excited to talk about it.
And for a gynecologist to talk about family planning, it itself looks like as if you do not want more business.
No, we do more. We do, because family planning is a continuous process.
Yeah.
It's not something that you do it at the first time and then it's over.
Yeah.
It's something which is ongoing process till the reproductive health, till the reproductive age of a female ends up, like up to maybe late 40s. Sometimes, so it's not something at a first go and then it's.
So what is family planning? Okay, so
And what are the components of the family planning? What are the different? I would say, how would you dissect it into different components?
Because for me as a layman, my understanding is to not have a lot of babies is family planning.
Yes, in the layman's, or just in a simple way, it's just the contraception, not having the baby, a lot of baby, or just the, I would say, a couple's or an individual's ability to attain the particular number of desired number of children that they want to have with the adequate spacing that they want.
Okay.
And in a broader way, I would say it's a planning of your future family, the health, the physical, mental, psychological health of your babies, your partner, especially the female partner, and it also encompasses a little bit overlooked aspect of the health.
That,
there is
I
a preconception.
I love babies, so I'm like, okay, any period or
if
any
someone
time
loves
of my life,
baby and he or she wants to have a lot of babies, I think if he or she if financially, physically afford with a good spacing, because I think every newborn baby has the right of the adequate time that should be given by the father and mother. So it's not the way that you keep on producing the baby and you're just ignoring them, producing 6 kids which are totally ignored. The female just produces the babies, keeps on going the process, and the baby is just in the lap and she gets pregnant again. So how can you imagine that that baby is going to have the adequate love and attention from their parents? They cannot give, because the female is busy in the other thing.
But there's the kind of era that that our mothers, we've seen them all healthy, mashallah, alhamdulillah. I believe that me, you, Hajra, we belong to the same era. So may it be my puppos, may it be anybody I see in my family who've had a lot of kids, they are healthier women now. And with women these days, they are anemic, there are other issues as well, the dietary supplements are not good enough, or their diet is not good enough. So why do you think that we see a decline in women's health now?
With the increasing inflation, increasing everything, you see, with the time the things keeps on changing. At those times when we were born, the families used to be a bigger number in kids. But at that time, the problems were very less as compared with today's problems. Social media has arrived, a lot of other things, and it's really difficult to brought up a kid in a healthy environment. It's not easy.
I'm really sorry, but this is something which I really need to kind of talk about, with our audiences as well, and that is that. So imagine, because back in those days, Hajra, I still remember that, that my father lived in a joint family system, right?
Yes.
So all my elder sisters, they were in a joint family system. My father still tells me that, okay, there was a time when I was progressing in my life, and I didn't have sufficient amount of money, so my grandfather would pay for my sister's school fee. And this was the kind of mechanism. Just yesterday, I was listening to another gentleman, and he earns somewhat around 50 or 90,000 rupees per month, and he's got babies, and he says that since I live in a joint family system, the burden is really low, and I think that kind of contributed to having a lot of babies, because there was no problem. It was a shared facility where everybody was living.
I think the era that you are referring to was much simpler and much easier times to live in, because there was not much diffusion of the materialism into our lives, because nowadays if you look, everyone wants their kids to go into the A category school, right? And the A category school costs a lot in terms of the money, right? And they want to wear branded clothes, they want to have very good furniture, they want to have very good living standard, and all of that requires a lot of money. But back at that time, they were very simpler times. People were not very, inclusive, or I would say people were not very considerate of the fact that they need to have their kids sent to very A category school, or they should be going to this functions or this
that
parties.
Kind of education they would get at home as well. Dadabu would tell you something, your chachus would tell you something. Anybody and everybody was like a teacher to you. Even the entire mohalla would, anybody could come and slap you as a kid.
But now you see see, people's choices and people's thoughts have changed, and they want, usually they want to have live a separate living, and most of the because of the inflation, everything, social pressures, the female have to work. Okay, most of the female, like we used to say that our mothers used to be housewives, simple housewives with a simple lifestyle. But now most of them are working ladies. Like I think more than 40% are working, and they cannot make up their everyday's needs if both partners are not working. So if the female is working, the standards, the living style, as you were talking about, I totally agree with it. You need branded clothes, you need good education, you need healthy living and healthy everything. So for that you have to maintain your family size, because just compare, if you have 2 kids, you will be able to give them adequate time. You can be able to give them a healthier living, a better lifestyle, rather than having 6 kids. So if you can afford, you're physically, mentally, financially, everything is fine, and you can give, you can guarantee your kid, because as I told you in earlier that this is the right of a baby to have every children, to have full attention from their parents, and to get a perfect education, a perfect brought up. And if you cannot cannot compromise that, then you have to maintain a certain number of families.
And Dr. Aisha, ideally, is it a case by case, I would say, explanation that you might have to give about how much time one needs to have between having the first child and the second child, ideally, especially considering nowadays that, like Shahzad mentioned, that the maternal health of the woman is not as great, or we are not the generation that are doing as fine physically as compared to our parents' generation or our grandparents' generation.
And in addition to this, we have moved from normal deliveries to C-sections, and people are looking for their own comfort. So the natural process of it, we're avoiding it, unfortunately.
Regarding this, I would say it's just a modern way of giving birth. You can opt for it.
But then that does not allow you to have a lot of babies now, even if you feel
exactly. But there's a taboo. Most of the people say that doctors have done C-section unnecessarily, unjustified. Believe me, most of the cesareans are done by the patient's choice.
I know.
They want that the baby should be born by a easier way, cesarean section, painless delivery kind of thing. And if a female comes, I come across such females, they come and they say that I just want 2 babies and I want an elective birth, elective cesarean section. I don't want to go to the whole thing of labor and that trauma and everything. So yes, sometimes we have to do, if a patient do not want to go through, but we usually encourage normal birth.
But would you say sometimes the doctors might have done it themselves as well? Because you have said, okay, most of the time
there are good and bad people in every profession.
You
can't say that everyone is fine. Sometimes, like in every profession, I won't say that everyone is 100% okay. But most of them, I think I say that most of the doctors do very dedicated work, especially the gynecologists. Sometimes the people say that we have been through the labor for hours, and at the end the doctor said that it's going to be a cesarean. Because you people, the common laymen, they do not know the dynamics of labor. Sometimes we have to do the C-section at the end. And obviously with C-section, the family size will be limited, because you can't do cesareans more than 4, even 3rd cesarean, 4th cesarean is going to be more complicated than the first one.
Right. So Dr. Aisha, now let's talk about the mental health aspect of it, because I think it's an important component of the maternal health in the family planning, and especially after the birth, we do see this is a very common thing, especially in the women, that is the postpartum depression that they are going through, and obviously they are going through a lot of changes, bodily changes inside their body. So what sort of help or what sort of assistance one should give towards the a young mother or a new mother that has just produced a baby?
Haja, it's a very interesting question again. Giving birth is not just a process, you say a physical process, you have delivered and that's it. Giving birth and having through the whole pregnancy 9 months, it's a big change in your life, especially for the first mothers who are becoming the mother for the first time. It's change in whole scenario. Like before that, you were able to sleep, you were able to go at any time, whatever you want. But after that, a whole new individual is dependent on you 100%. So your whole life changes. There's a mental change, there are physical, psychological aspects, especially postpartum depression, so common because female is not getting attention from her partner, her family members, the support she needs, and obviously lack of sleep, the baby cries, the baby wakes up at odd hours. Yes. So that it's a whole change, and people know to understand that. Female are quite sensitive during that time, and they need the support from their family, from their husbands and everything. So I always, whenever patient comes to me, I tell them about the postpartum things that they are going to pass through. I always tell them in one sitting that you are going to face these problems, so that they get mentally prepared for the change.
Right.
Yes, and after that, the birth spacing is important, because if she has been through it's a big trauma, you know, big trauma,
Obviously,
physical, psychological, been through pains and everything. So she needs a time of rest. If she will not get an adequate time, you know, in Islam it's also advised to breastfeed the baby for the 2 years. It means that Allah also wants to have a proper spacing. If you are nursing your baby, you can't get pregnant again. So for 2 years, it is the baby's right to be in mother's lap, to be very close proximity with your mom.
That's true.
So it gives a very positive psychological effect on baby and mother as well, mother-baby bond. And with that 2 years, the mother also gets a rest. And she has the time to recover from the previous trauma, recover from the previous pregnancy. Is not a disease, but it's a state of burden on your physical
Exactly,
health.
and in addition to that, obviously, because you know, if there's not adequate spacing, what I've seen is that I've seen 2.5 years and 3 years kids going to school. You know, it's because the mother really needs to relax. You know, it's like a 24/7 hands-on job. So very quickly, because we're only left with last 3 to 4 minutes, one more thing, because obviously it can't be one formula or one size fit all. So what are the family methods available for people? And in addition to this, unfortunately for people who've been trying to have babies, do you think that scientifically we have improved and that now they can certainly expect a good news?
There are a lot of ways of family planning, and as you told, it's not a fit for all. It's not some kind of, it's always a customized thing, or we have to tailor the management, tailor the type of contraceptions, and it depends upon the individual's or couple's need.
And if it's healthier or not?
Yes, of course. We have certain guidelines and we follow them. If someone has, for example, gastric issues or liver issues or anything else, she can't be taking the oral contraceptive pill. But if someone, and if she can't be compliant with her medicine, obviously we are not going to give her something which she's supposed to take on daily basis, because she will forget it and it will be a failure of contraception. So preferably, if someone wants a long-term contraception, we have options. Someone wants a short-term contraception, we have options. If someone has completed family and now the couple wants a peace of mind and they want to relax, then we have permanent sterilization techniques as well, male and female both, and both of them are very easily available. And now we are doing it laparoscopically as well, which is a very, you can say, a daycare surgery patient comes in the early morning and go by the evening. So it's not a long or major surgery. Similarly,
can there be complications of it?
Minor complications can occur, but very rare. We make sure that she's a candidate for it, she's fit for the surgery, then we opt for them. Obviously, our duty is to give them the adequate knowledge and give them the choices. It's a patient's choice, but we just guide them to the better one.
Thank you so much for saying that, because you know, for all of those people who are watching us right now, you know, and are listening to Dr. Saib over here, it's not that we are recommending you to do or, you know, undergo such treatments. It is for the experts. You really need to go to the doctors themselves, discuss it out with them, and they will be the ones who will guide you. You know, it is for us to kind of just inform you that these are the available methods out there.
And they have to come pre-conception, like before having first baby, they should consult a doctor, a gynecologist, so that she can tell you, she can guide you in a better way how to start the family in a better way, to prevent the complications which are avoidable, which can be prevented.
And very quickly, people, or unfortunately couples who are not being able to have babies as of now, you know, what would you recommend for them?
This comes under another topic, that is subfertility.
But it's still family planning that
yes, family planning, but if who do not want to have, yes, again I have told you long-term and short-term contraceptions we can have.
No, people who are not able to have babies.
Then they have to go through certain tests and things like that. This is a different kind of thing.
Exactly, and would you recommend over here that it's for the men to get tested first?
Both of men and female. It's easier for men to get tested because it's just a one test, semen analysis, but for female it's a whole list of tests.
Because usually it's a stigma over here that men feel that, you know, okay, I'm
men
fine.
feel like something of their self-esteem, and they get most of the educated people, they refuse to get tested. And the whole focus is on the female.
Yes, Yes, and I think it's high time that, like Shahzad mentioned, that we need to go towards the gynecologist in order to have more, so that you can become more empowered as a couple, as an individual, as a family, and make more informed decisions regarding the family planning and regarding the reproductive health of both the partners, right? And with that, we would like to wrap up this segment. And thanks to Dr. Aisha for coming in. Thank you so much, Dr. Aisha, for having this wonderful conversation, for very informed discussion on the family planning. And we will continue to have such sort of discussions that empower individuals out there in order to make more informed decisions. So with that, we will say Allah Hafiz and bid you farewell. And until next time, it's a goodbye.
Good
Allah
morning.
Hafiz and good morning.
Thank you.